Dzień dobry wszystkim obecnym tutaj.
Ladies and gentlemen, good evening, and we are here for another meeting dedicated to how to help those really affected by the most severe misfortune, by war and by huge trauma and tragedy. But today we also want to actually focus on a slightly different topic, and we were encouraged to do so by our most distinguished guest. We have today Professor Frank Dattilio. He's an outstanding figure, really, when it comes to CBT, and he is the author of over 300 publications about therapeutic work, about clinical psychology, about forensic psychology also. And he dedicated a huge chunk of his life really to how to support people who suffer from all sorts of difficulties. And our clients, but it is an extremely important topic for us, he dedicated also work to how to help the helpers, how to help those who help others. And this is particularly important at this day and age, at this time, because it's hard to support others when we are under a huge burden, under a huge load. We are under the burden of these traumatic events happening right next door. So today we are going to learn from Professor Dattilio, and we are very grateful to him for this topic, helping the helpers. So CBT for those who work in mental health care. And we will talk about many important topics today, and hopefully you'll be able to make use of it very, very soon. And I have to say that our contact with the professor here has been outstanding, because not only have we actually managed to arrange this conversation, for him to talk about these very tough topics, but also it's actually kind of light and heartwarming. Also, it's kind of digestible what we are going to hear from him. So thanks a lot, Professor, for being with us, and thank you for being available and for helping us, for supporting us and helping us to support one another. Thank you very much, and the floor is yours.
Okay, we ready? Mm-hmm. Okay, now let me just get the PowerPoint here. Well, I'd like to welcome everyone today, and as you have received the introduction, my name is Frank Dattilio, and I'm going to be providing you with a very important seminar today. In my opinion, is you've had a wonderful compendium of different seminars and training programs, thanks to Iga, and I want to say Dziękuję, Iga, for putting this together. It's a wonderful series and a wonderful thing you're doing. And Bóg Ciebie błogosławi. God bless you for all this, for you doing. It's a wonderful thing. I also promised Iga I will not say any of the bad words I know in Polish or Ukrainian. So I will behave myself. But I want you to know I know them all, because I always learn them when I go to different countries, just so I don't make terrible mistakes. Obviously, everyone has been doing a magnificent job working with the refugees from the Ukraine with this very difficult situation. God bless you all. And you've received a lot of training in your own experience and education, as well as now. But today is special because we're talking about how you can take care of yourself. And this is a very important seminar, because I think, if anything, mental health therapists are notorious for ignoring that and not taking care of themselves enough, in which the point reaches that it sneaks up on them and overwhelms them and creates problems, obviously. I first started doing this seminar.
Frank, przepraszam bardzo, nie chcę przerywać, bo słyszę, że...
Sorry, I don't want to interrupt, but I see that we are actually entering this very important topic, and thank you for this, but I just wanted to ask you, would it be possible to click the slideshow so that we can see this full screen? Can you click on slideshow so we can see your slide full screen? So that these, this sidebar disappears. So could you click slideshow in the top part of the toolbar? Then we could actually look at your whole slide and see it full screen.
Okay, sorry. So as I was saying to you, I developed this many years ago when the ex-Yugoslavia had fallen under the civil war. And I went over afterwards to help to do some training in crisis intervention with the psychiatrists and psychologists there to deal with all of the fallout from the war and the survivors. And what I learned when I was there is that many of the doctors there were suffering from the same thing, not only because they were exposed to war, but the overflow of the different victims that were left was overwhelming to them. At that time, I realized that there needed to be some kind of help for individuals who were helpers or treaters, because there's fallout that comes as a result of this. And as time progressed, I learned that there was a propensity for them not to express when they were overwhelmed and they had difficulty. So I developed this brief seminar to help them become aware of some of the vulnerabilities that we all have as a result of this kind of work. And I'm going to talk about that today. Albert Schweitzer once said that the purpose of human life is to serve and to show that compassion and the will to help others is what we do. And it's true. But when they talk about help others, they don't talk enough about helping ourselves. And that's very important for us to keep in mind. So I'm going to try to conform this to the refugee situation. And I want to say again, dzień dobry to the Polish, and I know there's Ukrainian people attending. So I would say dobry dzień to them and welcome. And Slava Ukraine to the Ukraine, because we are all here to help you in the Ukraine. It's important to know that aside from frontline professionals, first responders, airline traffic controllers, police, firefighters, bomb squad experts, mental health therapists have some of the most stressful jobs in the world. And we deal with some of the most challenging people in society over and above traumatic situations, such as psychotic disorders, sexual, physical abuse, personality disorders, sometimes very severe anxiety and depression, bipolar illnesses, suicidal, homicidal behavior, aggression and anger problems, and marital and family problems and distress. And also with crisis situations, such as the one that we're facing, this is also a very strong stressor over and above all of those things that already exist. So we need to understand that even with the crisis of the refugees, many of them have already had their own mental health problems that begin with, not to mention now what's superimposed on them, such as post-traumatic stress or just traumatic stress as a result of the situation. So you have your hands cut out for you. You have a very difficult job with these individuals. And I know that some of the other seminars have focused on dealing with that as well. But not only are we exposed to the stressful psychopathology that exists, but we are expected to fix it. We're expected to help them as mental health clinicians do something for them to make it better. It's a lot of pressure on us. And sometimes after years of conducting this kind of work and treatment with severely disordered individuals, severely traumatized individuals, the psychological and physical impact of our work on us as human beings can be very profound. And some of this has to do with the fact that we are drawn to helping others in extreme situations. Most of us have gotten into the mental health profession because of our fascination with psychological processes, our desire to help others, our desire to reduce human suffering, okay? And sometimes, if I've often said many times, our hearts are bigger than our, I won't say the D word, but it's bigger than our back end sometimes, because we're too much involved with wanting to help and ameliorate or soften, lessen human suffering. There's an American saying that there's nothing stronger than the heart of a volunteer. And that's true. And when our hearts are in what we do, we become vulnerable ourselves because of our need to feel and own some of what they're experiencing. However, we commonly bring personal vulnerabilities to our career, which makes us susceptible to experiencing the same symptoms that they are, sometimes secondarily to what they're going through. And these vulnerabilities sometimes can be a great source of stress, strength and compassion, but at the same time, they can also be a source of stresses as well. I want to consider a couple of alarming facts because it's important you to know you're not alone, that other people, well-noted people in our field, have suffered from the same kind of issues. During the course of his illustrious career, Sigmund Freud suffered from the following. He had frequent blackouts, mild agoraphobia, serious addiction to cocaine. He also refused to quit smoking after some 30 surgical procedures from nicotine and was self-complained neurotic. Now, I know some of this stuff because when I was a young fellow in the field, I worked for Joseph Wolpe, the father of behavior therapy in Philadelphia. And back in the late 1970s, early 80s, he had a June seminar every year where he would invite well-known people from all over the world. I didn't realize how lucky I was in those days because I was just a young kid, pretty naive. But I had sat in on private seminars with people like Viktor Frankl, Sophie Freud, Anna Freud, Peter Sifnios, Albert Ellis, a lot of well-known people. And Anna Freud had come to visit with us, and she would talk a lot about her father because he had a lot of problems in his life that often were not talked about. And these were some of the problems that he had. So he was very affected by the work that he did. We also know that there have been many prominent cognitive figures have committed suicide during the course of their careers because of depression. Aside from Viktor Frankl, we've had Bruno Bettelheim, the child psychologist, developed cancer and took his life. He tied a plastic bag over his head, suffocated himself. Lawrence Kohlberg, the developmental psychologist, took his life. William Steckel, physician and psychologist. Victor Tuck, psychoanalyst and neurologist. And our own illustrious Michael Mahoney, who was a cognitive behavior therapist, a constructive psychotherapist, took his life a number of years ago. It was very shocking. In 1999, he was hospitalized for exhaustion and stress due to fatigue and pneumonia. He admitted at that time that it was a result of his harrowing schedule of traveling and lectures and clinical work. He just did too much. And by 2006, we had been with him in Sweden at the World Congress and didn't see any clue And shortly after that, he hanged himself, took his life. Very, very troubling, particularly when we think about these people that really should have insight into the fact that they're suffering this badly. What happens to us? Well, the answer is that we're human beings, and anybody can be affected by this kind of stress. So it's something to take note of. Two major studies in the United States examined stress-related symptoms in mental health trainees. And there was a general health questionnaire that asked about symptoms that they experienced. Out of the survey, 281 mental health professionals were surveyed. 59% of them reported clinically significant distress due to their work. 75% reported moderate to high levels of stress as a result of their clinical training alone. 73% reported clinically significant levels of distress among themselves while they were still working. This was in a recent survey in Australia, while they were still working with patients, many of whom had the same symptoms. And as a result, in 2019, the World Health Organization had classified burnout now as clearly an official diagnosis, which is placed into the International Classification of Disease, ICD-9. These involve varying degrees of burnout, which of mental health therapists simultaneously experience disparate amounts of emotional exhaustion, or what many people call compassion fatigue. You just have no more to give. Depersonalization and diminished feelings of personal accomplishment, despite all the good work they have done. Research has increasingly recognized burnout as a significant challenge that many psychotherapists face, and they don't even really realize that they're suffering from it. Recent meta-analysis of 33 studies indicate that 40% of psychotherapists could be categorized as experiencing some type of burnout. And a subcategory of burnout, namely compassion fatigue, that was developed by a nurse after Joinson, after she realized that a lot of her nursing students and staff were developing this loss of compassion for what they were doing and for their patients. It's a condition that tends to compromise their mental health professionals' ability to express or experience empathy toward others, which is very important in what we do. In another recent study, the American Psychological Association surveyed about stressors that affect them in their professions, and most frequent areas reported were burnout, number one. Two, countertransference, feelings negative or unfriendly feelings towards the people that they were treating, that they were annoyed by them or upset with them. Vicarious traumatization, meaning they started to adopt the same symptoms that their patients had or the clients had, especially individuals who have been through terrible traumas. Personal losses, and also problems with collecting fees and management money and time, as well as conflicts with coworkers. These are some of the biggest areas of concern. The same study asked participants about the experience that they had with psychotherapy. How many of them really tried to do anything or sought therapy? We found that 86% reported that they received psychotherapy at some point in their lifetime, but 59% admitted that there were times when they could have benefited from treatment, but never sought it. They never did anything about it. Why? A lot of reasons. Embarrassment, lack of time, lack of money, denial, believing that we're supposed to be stronger than others, or what I call the Superman or the Superwoman syndrome. And also the notion of sometimes arrogance, that people just are beyond a belief that they are affected by any of this stuff. They think that somehow they'll be looked upon with disdain or with less respect if they're showing signs of symptoms that they can't handle it or they're weak. 3 out of 4 therapists have experienced more distress within the past 3 years. The principal cause was usually some type of relationship problems. More than 60% of the people in that study suffered clinically significant depression at some point during their lives and their careers. Nearly half of the people in the study admitted during the weeks before the personal crisis, they were unable to deliver the care to their patients, and they knew it, but did nothing about it. Mental health professionals portray a chronic disregard for their own self-care. Again, why is this? Well, some good and bad. Some, again, don't want to face it. They believe that it'll go away or they'll be immune. They're afraid that it's going to impede their ability to help others, or they may have to leave, take a leave of absence. But they forget the fact that if they're impaired, they can't help others. Mental health professionals who work with trauma, particularly survivors, commonly experience post-traumatic stress-like symptoms themselves, including withdrawal from family and friends, emotional numbing, loss of interest in everyday pleasures, or what we call anhedonia, preoccupation with clients' problems or patients' problems, adoption of patients' symptoms as their own symptoms, almost out of compassion in a way, or sympathy pains, and physical symptoms, insomnia, and even sexual dysfunction. It's not uncommon that the vast majority of mental health professionals admit to working too much when distressed and to being ineffective. And nearly all of the individuals in the aforementioned study who were surveyed acknowledged that they were aware of the fact that doing so was unethical. We promote self-care to others and their needs, and we put our own on the shelf, which in many respects may be hypocritical. And the biggest reason, again, is because individuals say, well, what about my patients? I have a responsibility to take care of them. Well, what about you? How many people have flown in a jet plane at one time or the other in their life? How many? Raise your hands. Right? All of us. Unless you have a fear of flying, most of us have flown in a plane. Do you remember the steward or stewardesses in the planes go through a in-flight instruction? And in that instruction, they often tell you that in the event of cabin depressurization, oxygen masks will fall out of the ceiling. Now, if you listen carefully, they say something very important. If you're traveling with a small child or an elderly or handicapped person, what do they tell you to do? You go. Put the mask on yourself first, then help the other people. Why do they tell you to do that? Because if you lose consciousness because of lack of oxygen, you can't help anyone else. So doesn't that apply to what we do as mental health therapists? And isn't it hypocritical for us to think that we shouldn't have to look at ourselves and our needs during the time of working with others? If we're going to be optimal in functioning with others, because we draw from ourselves to serve as the instrument of our work with others, isn't that common sense? Of course. So ask yourself these questions. What attracted you to the field of mental health? God bless you. What drew your interest? And what ways are these factors a strength and also a vulnerability? What do I find most fulfilling in my work? And what do I find stressful in my daily work? What are some of the less healthy negative coping strategies that I employ with my own life? Am I working too hard? Am I putting too much time in? Do I have enough balance? If I work hard, I play hard. How do I prioritize self-care activities compared to the demands of my work? When I was young, I used to go to the shoemaker with my mother, who was an Italian man, and he was always working on people's shoes. They called them cobblers in those days. They take a shoe, you'd sometimes buy a pair of shoes, you'd keep them for 25 years because they would always resole them and reheel them. And one day I was behind his workbench and I noticed he was working, and I noticed his own shoes had holes in them. It made me laugh. And then his son came walking in with the shop, and he had holes in his shoes. And it made me laugh because I thought, here's a guy that takes care of everybody else's shoes. He can't take care of his own shoes. Quite a hypocritical thing. So how do we prioritize self-care activities? What are the personal and professional liabilities of delaying our own self-care? So what I suggest that we do is, first of all, accept the fact that we have the need to even examine ourselves and make an assessment. If we're going to be good professionals, we go to training seminars, we get updated, we go to learn new skills. What about learning to take care of ourselves as one of those skills? It's now an ethical requirement in the United States and Canada that you must take credits in self-care and self-help to keep yourself viable to help others. And I recommend that if you're not sure, that you use some of the self-assessment measures that have been designed for mental health professionals. One is called the Maslow Burnout Inventory, the MBI. And that's designed, particularly for mental health professionals, for us to take our own temperatures and ask ourselves objectively, are we starting to show signs that suggest that we have some burnout? Another one is the burnout measure by Pine and Aronson. And the other is a professional quality of life inventory. These are great inventories. They're available. I've got the references in the back for you. Take them. You don't have to tell anybody you're taking them, but just take them and answer them honestly and see where you come out. Areas that we need to address. Do we have adequate personal coping style? How do you cope with a rough day when you have one case of trauma after the other? I work with couples and families, and I do other kinds of treatment. But one day, many years ago, went home with a terrible migraine headache, and I just had to put a rag on my head. It was terrible. And my wife said, "How was your day?" I said, "Oh, I don't know. It's his headache." But I saw about 9 people that day, and I realized, oh my God, they were all couples. They were all disgruntled, arguing, screaming couples. I had such a headache. It was overwhelming to me. So I asked myself, am I seeing too many people? Am I taking too many of the difficult kinds of cases that I shouldn't have at one time? Should I spread it out? Should I refer them? What are unrealistic beliefs and expectations about my ability to handle stress? This Superman syndrome or Superwoman syndrome that I call it, where we say, oh, I'm tough, I can handle it. One time somebody said to me, well, you must be made of iron. You deal with really tough cases. No, I'm not made of iron. I'm made of flesh and blood like everybody else. But I was young then, and I was considered myself kind of bulletproof. Nah, that was a mistake. Lack of collegial and personal support. And these are all things that we're going to talk about in a few minutes, because these are remedies for helping us through some of these difficult situations. Do I have too large of a caseload? The problem is when you're well trained and you get good at what you do, everybody wants a piece of you. Everybody wants to see you. And I saw this a lot during the COVID, where the doctors and the surgeons were starting to have panic attacks because they had to wear all this masks and shielding, and they were overworked with all of the COVID cases, and they were starting to have anxiety. And they would call me and I'd say, look, I can't, I'm busy right now. I'm taking, no, I want to see you. I only want to see you. And, I heard you're the best. No. That's a myth. There are other people just as good, if not better. Give them a list of people. When your ego is a little vulnerable and you want to help other people, you take them on an overload. And before you know it, you're up to here with it. Too many challenging cases. Know when to say no. It's beyond what I can do right now for you. Length of non-work stress. How much time do I really spend in downtime? Do I have other hobbies, or do I have other avenues for recharging my energies when I'm not working? Do I like to read? Do I like to hike? I like to bike ride. Many years ago, I decided that I wanted to take up cooking. So I started cooking. It was like a nice idea to be a hobby. And the problem was that I wasn't very good at it. In fact, it got so bad that my children started praying after the meal in our house. Some of them gave up their allowance if I would stop cooking. The more I tried, the worse I got. And it was a problem because my wife was such a wonderful cook. So finally she said, look, this has got to come to a stop because the kids are getting sick and they're not happy. And so give it up. So I had to find another hobby, but I tried. So I went into doing some artwork, which was safe. Nobody was going to get killed from me doing some artwork. Find something that makes you happy and use the other side of your brain, not frontal lobe, but you want to do other activities like physical exercise, bike riding, juggling, even writing and journaling, writing out longhand, because you use the motor cortex of the brain when you do that, and it's very soothing. Okay, find something that you're enjoyable. You don't think about work. You can disengage and become a different person. That other facet of your personhood can enjoy and embrace. American Psychological Associations and the Canadian Psychological Association both say that psychologists and mental health professionals strive to be aware of the possible effects of their own physical and mental health on their ability to help those who they work with. And now ethical standards and principles mandate that we strive to maintain cognizant and potential effects of our own physical and mental health being to be ethical psychologists. So the self-care and self-reflective practices are now part of a standard of functional competencies in the field. And efforts have been made to ensure that graduate training and students, residents now have this as a standard practice treatment with themselves. All right, so let's get back to some of the warning signs, how we can realize them. One, frequent feeling tired. Even when you're off, even after you've rested or go on vacation, you're still tired. You can't shake it. Another one, arguing with others over minor issues, particularly the people that we love the most. Inability to relax. When you're on vacation, you're still thinking about work. You're still thinking about patients. And what I've done, what I could have done, if I'd done enough. You got to be able to disengage. Constantly feeling in demand or under water, under tremendous pressure. They just keep coming at you. It's endless stream. Lacking patience or tolerance. Being short with others. Again, another sign that you're frazzled. You're wearing thin. Again, we're only human. And as I mentioned before, compassion fatigue, burnout. I just don't feel the compassion for people anymore. I've just been so saturated with it. It doesn't give us enough objectivity because we're owning too much of it. I'm spent. Feeling as though there's insufficient time for you, your family, or your friends. Just don't have enough time in the day, which a lot of people then find they start getting up later and going to bed later, and then they're cutting their sleep short. That's no good. You should get 6 to 8 hours on average to get good restfulness. Memory and concentration lapses. When you're 35 and you start having symptoms of onset Alzheimer's, not good. You know, you're too overwhelmed. Lacking interest in or time for socializing or engaging in recreational activities. You know, you start cutting that short to see other patients or to do your paperwork or get done what you need. Feeling irritable, tired, and unfulfilled at the end of the workday. So make a list of the personal indicators of distress for you. Your personal, they're different from anybody else's. You know, have there been changes in my behavior and attitudes? And your spouse and your family members are the first one to see it. Even my dog could see it. You know, come over and start licking my face. I knew he thinks there's something wrong with me. Changes in my thinking style. You know, are you starting to look at things more cynically, with less hope? What does that sound like? A lot of the cognitive distortions that our patients have. Comments from others, especially spouse members, about their observations. Differing reactions from others who know you well. And sometimes our patients start to treat us different. You know, one time a lady said, you know, you're not as attentive as you used to be. Responses that tell me maybe I am not listening, but I'm tired of listening. So one of the strategies is to be able to recognize this. Number two, try not to see people in a home office. Keep it separate. When I shut the door in this office, I go home, I decompress from the time I get in my car and I drive home. Sometimes I take a longer route home to clear my head. Once I drive into the garage, I leave my bag in the car, go in, take off my shoes, and then unwind. No phone calls, no text messages, no emails, no work. Eat dinner, relax. Take expanded lunch breaks during the day or take walks. Very important. Took a walk today just to clear my head before I did this seminar. Nice sunny day, got fresh air. Meet regularly with colleagues and talk about what you experience, or just play cards or have a good time with them. People that understand, that have a sense of what you go through. Mindfulness meditation, progressive muscle relaxation, meditation, yoga, all wonderful instruments to help us decompress. And also some techniques for our work with extremely challenging and difficult cases. I use it called the frozen sponge analogy. And here's my sponge. Frozen sponge. What do we do with a sponge? What's the word? Polish, marzagomka, right? Gomka, sponge. It's Ukrainian is zamorano stene hopka, right? I think. Am I getting this right? Tak? Yes, tak. This is designed to absorb water, correct? It wants to absorb water. That's what it does. If it becomes too saturated with water, what happens? Doesn't work. It's like human beings. If we become too saturated with emotion, we flatten out. So if we would take this sponge, put it in the freezer, not overnight, but just for a couple hours, what would happen to the sponge? You're scratching your head. You don't know? What's going to happen to the sponge? Of course, it's going to harden up and it's going to absorb less water. It'll absorb some water, but not too much. Okay, that's what we want to become, is like frozen sponge. Be able to compartmentalize what people are telling us to the point where we inoculate ourselves from becoming overwhelmed with the emotion, because some of the stories are unbelievable. They're horrible. I heard from a colleague who was working with the Ukrainians that there was a young 15-year-old girl, a hypersonic missile landed in her neighborhood and destroyed her home and her whole family. She was the only survivor left, 15 years old. And to add insult to injury, she was trafficked, abducted, raped, and now she's pregnant with her assailant's child. She's carrying a child that she doesn't know if she wants. So she decided the best thing to do was to take her life and leave this world. And that's when they found her. They started to work with her. The psychologist said, I'm having trouble. I can't keep my mind on what I'm doing. This girl reminds me of my niece. I feel horrible for her. And I find myself, I can't sleep. I can't rest. She lost her objectivity because the story is horrible. How am I going to help this baby who's 15 carrying a baby? She's lost everything now, including her virginity. Right? So you've got to be able to compartmentalize some of that, or it'll overwhelm you. It'll obscure your ability to stay focused and help her with what you've got to do. I never became a surgeon because I don't care for that much blood. And I once said to one of my friends, how do you deal with all that blood all the time? Every day he's in there. He said, I never see the blood. I said, what do you mean? It's all over the place. He said, I don't focus on the blood. It's inconsequential. Let the vascular people worry about the blood. I worry about the organs and repairing them. I focus on what I'm doing. I make the repair. I don't even see the blood. I don't even know how much blood loss there was. They handle that. It made me think that's what we need to do. We need to stay focused. And this is what mindfulness is good for, and cognitive behavior therapy, to keep us focused on what we need to do to get in and do the surgical repair and help them. It doesn't mean not being compassion with them. Yes, you be compassion. You hear what's going on, but you don't absorb it all. You don't own it all. You can't. You can't do that, or it'll ruin you. You have to help the patient deal with it and separate it. And that's our job. So very important. If there's one single factor, this is one of them that really overwhelms us and it cripples us. And this happens a lot when we have a deluge of a lot of patients to see and not enough therapists to go around, like our situation in Ukraine with the refugees. And also we don't know how to balance enough. We take on too much. I do the same thing. I did the same thing with this. Terrible time when I got the call about doing this. Okay. It couldn't have come in at a worse time, but I decided I have to do it. I have to give something back. So I sectioned off some other stuff and farmed it out and said, I can't do that right now. I've got something that's more of a priority, the Ukraine. They don't sleep. I don't sleep. I help them. And this is what we're doing. But again, you know, this happens and you have to be able to set priorities and shift things around or shuffle them. You can't do it all. So stress inoculation techniques, a lot of Donald Meichenbaum's early work with that. Learning how to, insulate yourself a little bit. He used to do it with children. He would call it doing turtle. He would teach children when they became overwhelmed with too much stimuli to pretend they're a turtle and go into the shell for a little while and then turn on the light, stay there, and then come out when they're feeling a little bit better and stronger. We're doing the same thing. We got to compartmentalize it. Sometimes we have to back off. Sometimes we have to make sure that we go to the gym and exercise, or dancing. Dancing is another wonderful thing to do. I used to like to do that. I look like I'm mentally ill when I'm dancing, but I don't care. It's a good release for me. Reconsider the types and number of cases you take, even in a pandemic, even in a deluge. Find other colleagues, expand the base, know your limitations. Know your limitations. You do that with food all the time. Some people don't. Most of us do. When we've had enough, we know that's it. No more. You got to learn to do that with your stress level. Use your own tools to help yourself that we're using with others. Emotional, cognitive restructuring, emotional reasoning, distorted beliefs, dealing with them. Very important. Self-soothing or mindfulness meditation techniques, wonderful for that. Walsh developed the TLC, the therapeutic lifestyle changes, looking at becoming maybe more spiritual, positive psychology, mindfulness, extensive exercise, healthy eating, those kinds of things, all very important. And as I said, journaling, writing it out longhand, not on the computer. You do with the computer all day. Forget the computer. Write it out. What's going through your mind. It's very soothing to write things out. And you use that motor cortex in the brain. Try it. Very, very medicinal. And also, don't be ashamed to get back into therapy. If you're not handling it on your own, consultation with a therapist. After all, we promote that. Aren't we hypocrites if we don't get back into therapy when we need it? Absolutely. Absolutely. May not have to be long. Why don't people do that? Not enough time. Same problem over again. Insufficient money, embarrassment. Oh my God, I'm in therapy. There must be something wrong with me. And if everybody finds out that I'm in therapy, that's not going to look good, is it? Dattilio had to go back to therapy. He's supposed to be like one of the best therapists in the world. Yeah, but he's still human. Everybody needs their batteries charged. Finding a therapist who is either a colleague or mentor living up to high expectations. Fear of being reported for unethical behavior, then something must be wrong with me. I'm unstable or unbalanced. Watch for early signs of distress and take action as early as possible. The sooner the better. Don't be ashamed. Take those measures, those inventories, talk to a colleague, and let's watch out for each other. If you see some colleagues, they're drinking too much, they're using too much marijuana, or they're depressed all the time, don't be afraid to do a reality check with them. Hey, how are you doing? You don't look yourself. You okay? Do it in a friendly way. Identity and external stress. Identify external stressors. Reduce the external sources of distress whenever possible, and develop some effective coping skills for other stresses that go on in your life, because you still got to live a life. If you have kids, or you have elderly parents or problems, you got to deal with those as well. They can sometimes be overwhelming. And check out and deal with any dysfunctional cognitions that you noticed you're engaging in. Like, is this effective? Am I really helping these people? Does it really matter? Am I making the impact that I believe I need to make? Sometimes making somebody all better is completely unrealistic. If we make small gains, that's a lot. Become the effective problem solver by brainstorming by yourself or with others or with a spouse. Possible solutions, evaluating the pros and cons, select the most feasible, putting them into result. Do not make self-esteem contingent on your work. You're going to fail. You know, I did couples therapy for decades, decades. And I did training all over the world. I've been to close to 100 countries. I've lectured on every continent except Antarctica. And there's only penguins on Antarctica. So by the time I'm working with penguins, I'll be ready to stop my work. People often ask me, what's your success rate with couples? You know what my answer is? 50%. I fail with 50% of the people that I work with for various reasons. One, they drop out. Two, they're too difficult. Three, I missed the boat. Four, whatever. But that 50% that I am successful with, I'm happy with that. I'm not going to be 100%. I went to another seminar one time, and this therapist who was doing the seminar, well known, I won't mention the name, said they have a 99% success rate. You must be a magician. Really? Well, here I found out what they do is they tell people, you must do everything I tell you, this, and if you don't agree to do that now, get out. So they truncated it to the point where they like conform the success rate. Well, that's cheating, you know, but they wanted to be able to say they had a 99% success rate. You're going to fail with cases. You're going to miss the boat. You're not always going to be able to be your best. Accept it. It's part of being human. It's not a pretty part, but it's part of being human. But don't put too much of your self-esteem contingent on that work performance. You can't save the world. You know, if you save one person, that's good. If you can do more, that's great. The other thing is, don't compare yourself to other people. Am I doing as much as so-and-so is doing? Am I doing as well as somebody's doing? No, you just stay in your own box and stay focused on what you can do. Keep things in perspective and avoid catastrophizing. Make sure you don't personalize negative events. Maintain realistic expectations and watch out for the Messiah complex, where you start to think that you can treat anybody and do anything. That's a delusion. Okay, stay away from that. It's a bad one. Set realistic, achievable goals for yourself and monitor the progress toward those goals. You know, the better the goal, the more defined, the more likely you are to achieve it. And give credit to yourself for achieving to recognize those gains in positive directions. Also, plan to reduce or eliminate self-defeating behaviors from your own repertoire. You know, look at adaptive coping skills and strategies that you can use. I also use humor a lot, and anybody who's attended my seminars know they always laugh. And you'll see some of the films that I made. I always find humor in working with others. I don't make fun of anybody. I make fun of myself, but I use humor a lot. It's very good for the soul, and you can, you know, always use it from a perspective that's helpful. Be able to make fun of yourself when you make mistakes and create alternative view of situations. You got to have some levity. I always tell couples when I work with them that, you know, love is blind, but marriage is a real eye opener. And they like that because it's a funny saying, but it's true. Develop a personalized emotional plan in advance for strategies that can be implemented at the time of any kind of acute distress. What are you going to do if you really get overwhelmed? So it's just when you have the most difficult cases that you have family problems or something happens at home or somebody gets, God forbid, they've become ill or whatever happens. What's the plan? What are you going to do in the event of that? Because you can't hold it all the balls in the air. When I was a young kid in the 50s, there was a variety show on television called the Ed Sullivan Show. He always had these acts that would come on. And he had one guy that was a plate spinner. he had these iron poles that were set up on a stand, maybe about 5 or 10 of them, and he would spin plates on the top of them, and he would set as many as he could spinning, and he was running back and forth and just keep spinning these plates, not letting any of them drop. Occasionally, they would drop. And I think to myself, good, because that's not reality to have a perfect spinning time. You're going to drop some plates. That's realistic. So it made me think nobody's perfect. And so many of us become perfectionists about what we do. And that's, again, another trap for us. Take more compassion attitude toward yourself as one would toward a beloved friend or a family member or even a patient. Give the same support and encouragement to yourself as you would to them. Look after yourself in terms of rest, diet, relaxation time, and create a variety of self-soothing or relaxing activities that you really enjoy. You want to adjust the balance of the life activities, ratio of pleasure to tasks, and keep it balanced. You also want to make up a list that you use to do fun things. Try new things together. I took my entire family on a whitewater rafting thing one time where we had to go down these whitewater rafts in the tube and big tube, and it was wonderful. We worked together. It's teamwork. Had a great time. Took our kids, our grandkids. I wanted to throw a couple of them out of the raft by the time we were done because they were driving me nuts, but we had a good time. And realize that when help is needed for ourselves, that the negative self-thought statements about sabotaging that or depriving ourselves of that need to be addressed. About I should be in control and I shouldn't need this. I'm trained in the field. Yeah, you're still a human being. You're still a human being. You want to create support system for yourself, and don't be afraid to reach out to a number of colleagues when you're having trouble. And again, as I said, seek professional help if that's appropriate, if you need it. There's nothing to be ashamed of. We all do it. The references should give you a little bit of a start with some of this. There's certainly a lot of other things, and there's some nice self-help books in here for professionals. There's one in here by John Ludgate on therapeutic effectiveness, taking care of yourself. That's a very good one. And a few others in there that I think John Norcross wrote a book, Leaving It at the Office, a guide for psychotherapists, self-help. All good books. So I want to take this time to open it to questions if you have them. Or we can just have general discussion. Or if you know some good jokes, I'm always open to them. I guess I have to pull out of this. Tell me what I need to do to where I need to go. We have 28 messages in the chat. So we answer some of those questions.
How can we develop this way of approaching very serious topics in such a light way as you, with this sense of humor and such distance and this lightness when talking about so serious issues?
You mean serious issues for ourselves or the patients?
No, dzisiaj się skupiamy tak naprawdę na
Well,
nas.
today we are focusing on us as professionals.
Right.
So it's a very important issue when we talk. It's a very important technique to take care of ourselves. So when we
Yes.
talk about serious matters, but in such a way that we can take a breath while talking about these heavy problems. Where did you learn that? How can we learn that?
Because once you accept the fact that you're human and you have to be okay with sharing some of this stuff. You'll realize that it's better for you if you can try to do that than to hold it in and let it overwhelm you. I mean, part of the problem is that the seriousness of what we're doing is harming us to begin with because of the nature of it, what we're hearing. So to be able to say, with colleagues, I'm starting to experience the same symptoms because I'm thinking about this too much. And that, it's, I need to talk about it because, again, we're all human. We all have, once others start sharing with you that they have the same sense of, wanting to, avoid dealing with some of this stuff, or they're thinking about it all the time. I mean, they realize that it's a natural issue and they have to relax with it, because if you don't, it'll eat you up. So I think the answer is realizing that if we don't make it a lighter issue for ourselves and talking about it with our colleagues or in groups, it's going to destroy us. And that's the primary notion that helps me personally deal with it. Any stressor. And I find that, the more I'm open and honest about it, the more my colleagues start talking about it too. Because everybody's afraid that they're the only ones that are going to be feeling this and nobody else feels it. And they're going to say, oh, there's something wrong with you. No, we don't experience that. Everybody experiences it. There's not one person in that audience that has not had a time where they asked themselves, is this what I was meant to do? Do I want to spend the rest of my life doing this? I mean, is this healthy for me? No. One time a patient said to me, you only do this for the money. I said, well, yeah, the money's a big part. You think I would do this for free all the time and listen to this stuff? You got to be kidding me. It's a lot of work. Of course I want to get paid to do it. It's not the only reason, but yes, it's a big part of it. I was honest and he started laughing. He said, thank you for being honest. We have to be honest about it. It's a very difficult field that we have. Very difficult. It really gets to you after a while if you're not taking care of yourself. So being honest about it is very, very important. And sometimes not to ridicule it, but we have to joke a little bit about it because it's not easy. I find it makes it easier to swallow and easier to talk to our friends about. Does that answer your question? I hope.
Odpowiada oczywiście.
Yes, of course, it does to a great deal, although this levity, this lightness, where you are embedded, you are immersed with those very heavy, severe issues related to psychotherapy. You write books, you work at one of the greatest universities in the world, and you're very much immersed in those very serious issues, but you have this skill to talk about those serious matters in such a human, you give them this human aspect, humane aspect, actually. This is a great skill. In the last weeks and months, I've been observing it actually in you when we were getting prepared to this meeting, where I saw your emails. You wrote emails in Polish. Nobody else thought about it. Nobody else thought about trying to communicate in this way in those difficult times. There were some better and worse moments, obviously, in the emails, but the very fact that you have this humane human contact, that's something really fascinating. And I think you're telling us, well, you're showing us to get inspired, actually, because apart from mindfulness, sleep, diet, and all these techniques and things that are quite helpful, but there's something that actually puts us in this human dimension, that it's easier to digest or swallow, like you said, easier to grasp and move forward with it in a serious way.
Well, you know, I'm also a little bit skupiec too. What do you say in Ukraine? Zvida. Zvida. Skupiec. So people often say that, you know, you're a little bit crazy sometimes. I say, yeah, well, you have to be crazy to be in this field. It's a crazy field. But you know, you got to acquire it. You got to work at it. It's a way you play your way through it sometimes, because if you don't, you'll crack up. I mean, you can't take it. I do a lot of fun things, and when I would go lecture, I would always make sure that we take side trips and do crazy things and go dancing, and that's why people know I'm a little crazy. They've seen me dance, but I don't care what they think, you know. So I look ridiculous, but you have to work at that. That comes over time. Yeah, writing helps. You get to write about things, and write about your mistakes, write about being fallible. It's like exercise. If you start working and building your body and you start toning up, you got to tone up your brain that way too, and your emotions that way. I hope I explained that. It takes time though, but you can begin right now by just being aware of this. You know, in the beginning of the slideshow, I showed you all those people that killed themselves. That's not a joke. They killed themselves, okay? That says something about our profession, that the great minds, some of the great minds of our profession were either addicted to cocaine, they smothered themselves with a bag, or they hanged themselves. That tells you something. They weren't not bad people. They were not crazy people. They were human beings that were overwhelmed and didn't know how to take care of themselves. Michael Mahoney's death, his suicide, devastated people in the field, because we were dancing with him a month earlier at the reception in Sweden. Couldn't believe it. What happened? What didn't he tell us? Okay. Should we have asked him, Michael, how you doing? Didn't do that. I know Art Freeman, the late Art Freeman, struggled with that because he didn't see it coming, and he was pretty close with him. So were a number of other people. You know, so you've got to take care of ourselves, because it will catch up with you. Maybe we can have some follow-up, Iga. I talked about this, you know, you have to talk with the people, but I'm willing to do some follow-up if we want to talk as professionals as a group on how to handle some of these things. I would be happy to do that. If I can share that. Very good, very important. 61 chat messages. Is that correct?
Tak, pojawiają się wiadomości.
Yes, that's correct. Messages are coming in the chat.
Okay, well,
good evening, Professor.
Good evening. So I want you to know I took the rest of the afternoon off for you. So if we need to go another hour or so, we will go till we answer all these questions. Okay. Tak. Ne?
Tak, pojawia się wiele komentarzy i wiele...
Yes, a lot of comments and a lot of thank you messages, really, that it has been really inspiring, your lecture. And if we could ask you some additional questions, because there is a whole lot of Ukrainian professionals here who have, you know, often stayed back home, and they are facing a huge challenge. On the one hand, everything that has been said here, how important it is to look after ourselves. We are professionals, therapists, but at the same time, we have needs in terms of support, help in Ukraine, and these needs will be huge, actually. And well, bear in mind, you know, ourselves really in this particular situation, we're wondering what should these professionals, what should they focus on most strongly, and how should they really go about it and plan it out in order to help themselves in this tough situation, but also to help their potential patients as much as possible.
Yes. Okay. So remember, an eye for an eye, one for one. You do one good thing for other people, you do good thing for yourself. You've got to take care of yourself at the same time. You have to change your thinking about the fact that that seems selfish to us, but it's not, because your batteries are going to run low. So you do one good day of work, you take some time for yourself the next day in the morning or later in the evening, okay? Something where you'd separate yourself from your work and forget about what you'd heard, despite how horrible it is. Remember, you got to freeze up a little bit, okay? My buddy here helped me get through a lot of things. Don't laugh. Hey, this is my child. Okay? Saves your neck. Be realistic. It is an incredibly overwhelming deluge of misery that have been created by this war. Everybody is affected. I mean, I can see the animals that are walking around in Ukraine that are affected. You can see it. The dogs, the animals are stressed. Everybody is stressed. So that's only going to be dealt with a little bit at a time. When I was teaching in Egypt, I went to the Great Pyramids every day. And I looked at those pyramids because they were all built by hand. And those blocks of stone, or some of them are the size of small houses. The Israel slaves brought them down on barges and used planks and jacks to put them in place. It took them years and years and years, a little bit at a time, but those are solid structures that aren't going anywhere, okay? It's a little bit at a time. It's so monumental that you're facing. It's not going to happen overnight, a little bit at a time. The other thing is you have to duplicate yourself. We can't clone ourselves, but we can duplicate ourselves by training more people and training paraprofessionals to deal with some of the less serious cases so that we're available to deal with some of the heavier cases. And then we need to rotate, okay? So that we're not doing the same stuff over and over again. Very important. It's called triage. We can talk about that more in detail when we meet later again. I'm just finishing the fourth edition of the crisis intervention book. And I have a lot of good stuff in there about that. And there's a whole chapter, an entire chapter on taking care of ourselves. So I'll make sure that you get that when the book's coming out in the fall, late fall. Very good chapter about that. You have to work, you have to develop a network, and but you got to remember, you got to only do so much. And that's why we need more people. We need to recruit more people because it's too much. And some of those other people are going to be farmed out. They're going to go to different countries. Some are not going to go back to Ukraine. Some will go back to Ukraine. I suspect that once this is over and people start returning to Ukraine and things are settled, there's going to be a lot of infrastructure running group programs and all kinds of good kinds of things that we can do to help on a regular basis. It's going to be years. It's going to take us years and years. Like Germany, what was completely obliterated. And yes, a lot of young German women, when there was the invasion, were raped and they took their own lives because they were just devastated. They lost everything. If you looked at Germany, it was leveled. It's amazing how they rebuilt that. Warsaw, another one, that was leveled during the World War II, completely rebuilt, as opposed to Krakow, which is hardly touched. So there's a lot of rebuilding with infrastructure, with people, and helping them. It's going to cross generations, this negative effect. It will trickle down into generations that have not even been born yet. So we're going to have to work on all of that. But we have time, but we can't destroy ourselves, because remember, the oxygen masks in the jet plane. If you lose consciousness, forget it. Forget it. You can't help anyone.
Tak, to bardzo pomocne i
Yes, that's very helpful. And thank you for these indications, for these guidelines. And Professor, you have talked a lot about this compassionate approach towards ourselves.
Please call me Frank.
Okay.
Professor, that's no good.
Jasne.
Look at me. We're colleagues.
Frank, mówiłeś o takiej współczującej postawie.
Yes, so Frank, you talked about this compassionate approach to oneself. And at the same time, we saw in this presentation how about the tragic end some professionals would meet eventually. And so I'm wondering, when we have someone close to us, maybe it's a professional, working in Ukraine, but it might be, simply a professional, a friend, a colleague in Poland even, but we see that someone is really saturated, like that sponge, you showed, and maybe they can't take anymore. And I'm wondering, what would you recommend that be done to actually, say to that person, talk to them, so as to prevent them from really getting involved in this, to oblivion in this oversaturation?
Well, first of all, you tell them how much you love and care for them, and that's why you're having the conversation that you are with them. And you say to them, I know that you would let me know if you saw it in me. I need to let you know what I'm seeing in you, and I'm concerned because I think you have to be careful. Let's talk together what we can do, because, I'm not beyond experiencing the same thing myself. And if you can be a friend, they'll open up to you. You gave them time. You got to reduce the embarrassment, reduce the fear of being considered disabled. Nobody wants to be disabled. If they're disabled, they can't work, they can't do what they're doing. And they want to avoid that. But you tell them that we're doing this to avoid you getting at that spot, because you're human, you're only human, and you're going to experience that. And then you be very, very direct with them, not forceful, but direct with them, and say, and if you can have a couple of people do it at the same time, not that you gang up on them, but maybe two people that they really care for, and you keep a check on them. You keep their pulse all the time. Keep your finger there, because you don't know what's going on in their head. Again, mental health professionals, as you saw earlier, are not beyond doing tragic, severe things. I mean, people who should know better. Michael Mahoney, what did he work with? What did he work with the most? Depression and suicide. You're kidding me. How did he not know? Because his reason and judgment was obscured by his emotional overwhelm. He couldn't see the forest for the trees because he was emotionally overwhelmed. He saw no way out. He hanged himself from his dining room chandelier. Michael was a weightlifter. So what we know about hanging deaths is when they're little children and they're hanged, they take longer to die because they don't have enough weight pulling on them. And when you're a muscular person, you have the same thing, because he had a neck like this. It probably dangled there for hours and hours before he died. That's somebody who really wanted to die. Okay, that's disturbing. So, you don't want that to be too late. And you say to them, you reduce the notion of them being weak or inadequate or a less than person than anyone else. We're all human. Tell them, I've had times when I've gone through times I was stressed out. Okay. We do crazy things sometimes when we're stressed. I'll tell you a story that when my kids were young, with all of my psychology training, I couldn't get them to take the damn trash cans out for the garbage night. So I was like frustrated because I know all these, worked with the best behavioral and cognitive people in the world, and I couldn't motivate these kids to take the garbage cans out. They bring them in, actually. They would take them out, they wouldn't bring them in. And then cars would hit them and they would be all over the place. So one day I lost my nerve, and I grabbed all three of them and I took them out and I said, all right, now hold hands. We're going to form a circle around the garbage cans. And they, girls were teenagers at that time, and they were saying, you're weird. What are you doing? I said, shut up, hold your hand. We're going to meditate and make these garbage cans levitate and work their way back to the garage. And the girls are sitting there going, you're weird. And my son was only 7 at the time. He's 40 now. And he said, Dada, I said, Michael, please, this is very important. Don't interrupt. I said, now hold hands and concentrate, and we're going to make these garbage cans lift up and float back to the garage. And finally, my son kept saying to me, Dada, it's very important. Listen to me. And I said, what? What do you want to say? He said, these aren't our garbage cans. I was at the neighbor's house. I didn't even realize it was their garbage can. You do crazy things when you get stressed out, especially if you're Italian. You're really sgoopy. It's a little bit, So we all come unglued to some degree. We got to, when you see it, and talk about the idea that you got a buddy check. We call it here, buddy check. You're doing okay. You're okay. We did this all the time during the COVID. Always saying, hey, how you doing? How you doing? Because we had a lot of physicians and medical personnel stressing out because they were exposed to COVID all day. So that, like, we had I remember a female surgeon was going home and she was taking off all of her clothes and washing down her bag and her body before she even went in the house because she was afraid of bringing COVID into her young kids. So they're very, very stressed. So we had the buddy check, like, how you doing? Are you hanging in there? And we'd have a coffee chat or donut chat kind of thing, but, distance, personal distancing, because that's when people needed hugs and stuff the most, and you can't give them. So buddy checks, and not afraid to tell them, hey, look, let's take your temperature. How you doing? Sometimes you don't look.
Wspaniale nam pokazałeś, jak tak naprawdę prosto.
You have showed us very nicely how we can show our care in a very simple way to another colleague, just to check, hey, buddy, are you okay? I really care about you. But please tell me, what about those specialists that, as we see, have some other difficulties? They work like automata, like robots. They have 40 patients a week, hour after hour, every time a new patient. And they say, oh, no, I'm fine, I'm okay. I had 5 minutes, I had my lunch, I can keep on working. We can see it's not helpful for the person and for the patients, but actually it's very difficult for us to react.
Well, and sometimes what I say to them is, you know what? I'm glad you can do that, because I couldn't. I started to get myself into trouble, and I didn't think I was getting into trouble. And then one time I realized that, I was overwhelmed. Now, if that doesn't jar it out of them, then sometimes you just have to wait. But you can bait them. You can open the door for them to start to think about it. Or just say, hey, listen, how about a break, though? You've been going great, but how about a break? We all need a break. I think hospitals and businesses and practices, clinics have to make it mandatory that people take a break. They have to take a mandatory mental health day off. I make it here with my women and the staff, mandatory mental health day off. And you can't do any work. Go out, go to the beach, go shopping, do something different, take a mental health day. Every month, I take them out for lunch somewhere, wherever they choose, 2-hour lunch, 2 hours, we sit, have fun. One time we stayed there the rest of the day. We didn't go back. So what? We had a great time. We laugh, we tell jokes, we eat desserts. Too much desserts. Woo. You got to promote it. But you can't, again, save everyone. And sometimes you're going to have colleagues that don't get it and they're going to just do it. Their day will come. Their day will come. You just do your best.
Jasne, jasne. Czyli takie troszeczkę...
Yes, I get it. So it's actually rather showing them and starting some doubt in that person that perhaps it's not the best path they're walking. Now, one more thing, if you don't mind me asking, what do your patients here, those that are, I don't know, they are used to you, for example, going on holiday, taking some break, taking some time off, what do they hear from you then? When they say, I would like to meet with you while you're going away, I need you. So what do they hear?
Well, I'd say I understand that and I appreciate it, but we have to come up with a plan because I need to recharge my batteries. I'm human like everyone else. And you want me to be fresh and alert with you, right? Is that true? Yes. Oh, yes, of course. Okay. So I need to go away and do that. I will come back though. And I tell them, you know, it's just the way it is. They understand. I've never had anybody not understand. And then you have to say, oh, look, I have a close colleague that's available in case of emergencies. Here's the number they're going to be covering for me. And now I've had other colleagues who said that their crazy patients have followed them on vacation down to the seashore and showed up there. Like, oh my God. Yeah, that sometimes can get bad. So you never tell them where you're going. That's another thing. Where are you going? Just away, other country. Don't tell them. Yeah, but you tell them, it's just, you know, I'm human, I need the time. And they know that. They know that from the beginning. So before they get wound up with their neediness, they know that I take these frequent breaks. And if you want to see me and want to see somebody else, then that's fine. Because they will also be the first ones to tell you when you're not being attentive. You look tired. You're not listening to me. Yeah, well, it's because you're not giving me a break. Well, I need to take a break. You have to be a little bit firm with it.
Jasne, to myślę sobie, że też super
Yes,
dobre.
I get it. It shows very nice. Well, thank you that you explained it to us in such a imaginary way so that we could actually see it. It's we have this rhythm of work, we have some duties, but we have some time to rest. But for now in Ukraine, everybody is overburdened with work. Everybody gets exhausted in all those areas as much as they can, like medicians, physicians, other specialists who try to help. I'm just wondering, to what extent can we tell patients there in that stressful situation, like, I need a break, I cannot see you every week, I can see you every 2 weeks. How can we show this human face in that situation in Ukraine, that tell the patients, I need to rest, even though I cannot rest as much as I
by developing skills that they can utilize themselves during the 2 weeks that you're not there. You can set up situations for them to look, they're going to have to start to learn to self-soothe. You're eventually going to have to move towards helping them self-soothe anyway, to rely on themselves. You can't be with them for the rest of their lives. So that's the time to start. What are you going to do between now and the time I see you? Let's talk about it. You're going to do this, 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 and this. I think that's very, very important, because now the more critical people, maybe they need to be in hospitals, maybe they need to be somewhere else. But they got to get used to having more than one person that they can rely on, because I'm telling you, if you wear out, they're going to be more angry with you if you can't help anybody, including yourself. So that's one of the things we have to do. I think also we got to start training more people to take on some of these and reduce the load and have at different levels. So they work with you because of your high level skills up here, and then they start to step down with others. Get them used to that if you can, because it's the only way to take large numbers. They did this during World War I in France and Germany, in France and the United States and Britain during the wars, because they had so many, they didn't call it post-traumatic stress in those days. They call it soldiers' heart. I forgot the term of it, but it was the precursor to post-traumatic stress. And they started, that's how groups got started. They started treating them in groups because there were too many of them for the doctors. There weren't enough doctors to go around. And we could talk about that too. I mean, that's something else that we can develop. And look, some of them are going to be unrealistic and demand. You just have to draw the line. That's all. You know, I can see you so often. Let's talk about what you're going to do during the interim, the in-between period, that you can rely on self-skills or other kinds of things. You know, there's lots of apps now and laptops and iPods and all that, pads that they can rely on and utilize. Lots of things. You can record messages for them to plug in so they, okay, you're alone, I'm away, this is what you're going to do. Remember what we talked about, you do this, 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 this. Lots of good applications. 50 years ago, if this happened, we wouldn't be able to do what we're doing today. We didn't have any of this. We didn't have cell phones, we didn't have computers, we didn't have anything. We barely had telephones that would reach, and the lines were very bad. Now we have all kinds of wonderful techniques, and looks like 82 now. Are these questions or answers or? And make sure you go have a Ziviec too.
Różne komentarze, różne komentarze.
Okay, good.
Okay. Jednym słowem też nam pokazuje, że bycie takim
So actually you're showing us that being a professional, a specialist, and taking care of ourselves in Ukraine now, it would be also by involvement in training other helpers that could take off the burden.
Absolutely. And they can be paraprofessionals. They don't have to be at the same level that you are. They can handle some of the easier ones, the easier cases, you know, or after you've made certain headway in treatment with some people, they can take care of them later. Very important. And Ziviec, drink a Ziviec every once in a while. Good Ziviec beer.
Jasne, czyli to byłby taki...
Yes, I get it. So this would be good management, actually. How much energy I involve into supporting other helpers to give them skills they require, but on the other hand, how we qualified those in need so that we actually send or refer the most needy cases to the most qualified therapists.
You have to set that up. There's you can set up a program that way. And I'm sure that's been done in some places. Maybe there's a model that we can access to do that. But I think that would be very important in this situation, because I think the number of refugees coming from Ukraine have gone up only, no? It's getting more into Poland, or are they going to Romania, some going to Moldova, other places, no?
Duża część z nich na pewno
A
zatrzymuje
lot
się.
of them stay in Poland.
In Poland, Polana.
In Poland, yes, in Poland.
Tak, często mieszkają jeszcze ciągle u rodzin.
Yes, they very often stay with families that open their homes to them, and they just stay there.
Bóg czerwony, błogosławiony. Yeah. Beautiful. God bless them. Okay, other questions, comments?
No
Anything?
właśnie, niech Bóg ma ich w swojej opiece, ale
Yes,
niech
God bless them, but also they need to bless themselves somehow and take care of themselves somehow. I understand that the frozen sponge analogy is not only for professionals, it's not only relevant for us, wonderful therapists and psychotherapists, but it's for people in general. And like I understand it, what you're saying today, you're making us sensitive to the fact that it's very important to expand this truth that without taking care of ourselves, we won't go very far. We won't be able to do whatever it is we have to do, specifically in those extreme situations such as war. So the frozen sponge is actually, like jokingly, but seriously as well, it's a symbol of not putting ourselves in a position to soak up everything that life gives us. I use a DBT sieve technique.
Yeah.
So when we think, like, what should I let pass this sieve, or what should I let keep inside the sieve? So I need to select things. So
Yes.
taking care of ourselves is very important in our
It's a metaphor.
profession.
Yes, absolutely.
But there's something that we should share with our patients, with our clients. We should do it on a big scale.
Yes.
So I'm thinking about sharing at the level of a system. I think it's very much needed to us and to people in such extreme situation. What do you think could promote it, that our colleagues listen to it, our friends listen to it, that they use it and treat it seriously, that our bosses start appreciating such an approach, that they that they start seeing that our the taking care of ourselves, it's for us to work better and not only to have fun, right? So how do you
Yes.
think we could share this idea and approach?
Well, first of all, I think they're probably ready more now than ever. If this situation hasn't made them ready, then I don't know what will. And also maybe sharing this, you recorded this seminar today, right? You have it on videotape or recording? Did you film this?
mam nadzieję.
Yes, I hope. Yes, that's what we usually do, because we want to further distribute it among other people who cannot join us today.
Right, and show it to them and say, out of this seminar, we have come to this conclusion, and this is something we need to do because the situation is only going to become more intense. I hate to be pessimistic, but it sounds to me that this isn't going to relent. It isn't going to stop very soon, and we're only going to have more and more burden of refugees, people going through difficult times. I think that longer that people remain in Ukraine, the harder it gets for them. If they eventually do leave, they're going to be very overwhelmed, obviously. So I think if you come up with a plan that's feasible and talk about how we're going to train paraprofessionals and semi-professionals to start to do this work, and then we go to them with a plan, they'll do it. They'll look at it. I don't think you have to sell them on the need that much, because now, I mean, they'd have to be completely blind and deaf to not think that they don't have a major problem. There clearly has a problem. That's one idea.
Tak, no miejmy nadzieję, choć wiemy dobrze, że czasem...
Yes, let's hope, even though we know that facts don't reach everybody, even in face of such dramatic facts, we sometimes stick to our beliefs. But you're encouraging us to open our eyes to ourselves, but also to our human environment, And we should encourage people to be open about it, about sharing it, about expressing this concern by, hugging somebody or showing our support. We're quite open in terms of physical gestures to show our support as Slavs. It's trivial, but that's something that can protect us or our colleagues to what happened to those stars of psychotherapy that you mentioned at the beginning. They knew, all of them were aware of what was going on, but due to the huge emotions, they could not stop this suicidal drive.
Very well.
Frank,
You know, I
this was
have, yes,
a very touching
I have
lecture.
taught a number of times in Poland. I've taught a lot in Krakow, and we have a lot of Polish community here in this northeast region of the United States. The Poles are magnificently hardworking, caring human beings. If anybody can do it, you can do it. The world has been watching you and are so impressed with your openness to take these people in. It's amazing. So I think that this is something that you can certainly accomplish, and I'm happy to help you as much as I can develop it if you need whatever. I'll be fluent in Polish by the time I get done with this, but that's good. I have to tell you this story when you have a minute about why I learned all the bad words in every country. Because I had a very bad experience many, many, many years ago. I grew up speaking Italian and then I learned English, and I learned Spanish and Portuguese. I know a little bit of Greek and Arabic, but not very well. So when I was learning Spanish, I was going to South America and Spain, and I love seafood, shellfish, clams, lobsters. The word in Spanish is mariscos. Mariscos, shellfish. But I mixed them up a little bit, and I would go to restaurants and I would ask for maricos, a plato de maricos with cocktail sauce. And the waiter would look at me and I think, oh, what, this they sell shellfish, and what's the funny look for? Well, I would get this look all the time. I guess they figured out what I wanted, and then one time I was out with a colleague and he heard me and he said, oh my God, Dattilio, you're an idiot. He said, what are you saying? And I said, well, I'm ordering shellfish. He said, the word is mariscos. I said, well, what did I say? He said, you said maricos. I said, well, what's the difference? He said, you just asked them for a raw plate of homosexuals. I said, oh my God. That's why I got thrown out of so many restaurants in Spain and South America. So I had to learn all the bad words after that so that I know what not to say and what to say. It was an innocent mistake, but the words were so close, it was an easy mistake. So I need to learn them all. So I'll learn more Polish. But I think that if I can help you do that, that's great. You all speak very, very good English anyway. Any other question?
Komunikacja nie jest problemem i Frank,
Well,
chcemy...
communication is not a problem, definitely. And Frank, you have communicated to us that you are open, towards meeting again in the future and really delving deeper into this and following up on this, because today we have talked about this on a preliminary basis, but tremendously important things have surfaced. Although with this levity you talked about, lightweight, the frozen sponge is definitely a symbol of something worth looking after and worth really having on us in our briefcase, on our purse, so as to really remind us of stuff. But yeah, hopefully we'll meet soon.
Yes,
we'll meet
of
again
course.
soon to watch, to actually to focus in more detail on what we can do, what we should do.
Yes.
Other, maybe not so much other things, but other ways of doing this, to really squeeze this out as a lemon, you know, to squeeze as much as possible out of it so as to live better, to work better, you know, so that we can help people more efficiently, because that's what we're here for.
Yes, absolutely.
Dziękuję bardzo, że się zgadzasz.
Thank you very much for concurring with us. And Frank, thank you
Absolutely.
very, very much.
bet.
Really, if anyone has been listening carefully, they will definitely take away a lot of suggestions, a lot of concrete suggestions, what to do to save ourselves before it's too late, and what
And
to
also,
do.
and also never use the word maricos in Spain. Mariscos.
Oj tak, musimy się uczyć
Oh yes, let's
We
learn
should.
languages constantly. Lifelong
Yes.
learning. Thank you very much. And I just
All right.
wanted to say 2 words of thanks to all our attendees. And the professor, obviously, but all the attendees. Thank you for being with us. Thank you for attending. Thank you for focusing on these topics, which are very important in our profession, and looking at this from so many points of view. Ladies and gentlemen, this week has been full of interesting things. We have had this excellent lecture by Professor Frank Dattilio, but on Friday evening, we are going to meet and talk about this using slightly a different language, about these serious trauma-related aspects. And so this is going to be a very special meeting with the language of psychoanalysis. A couple of interesting terms. We will be able to learn quite a few things containing, for instance, and symbolizing an important area or important areas from a slightly different linguistic field, so to speak, but very interesting nevertheless.
And very
so
effective. And very effective too. You're going to learn some very
bardzo
good things.
skuteczne.
Yes, and very effective. We are opening up towards everything that will be effective and helpful, without forgetting, obviously, this main direction of our work, so as to draw on these important models. And on Saturday, it will be possible to translate these difficult things we're talking about into practice, because we will have a practical seminar, a kind of a supervision seminar, kind of a look at, you know, how to work with patients with PTSD or other disorders, how to work with them specifically. So feel invited. You're most welcome to attend. A lot has been going on. Thank you, Frank. And
Okay,
a lot
so
of
let me say dziękuję to the Poles, dziękuję to the Ukraine, and again I say this, Slava Ukraini for Ukraine. Okay, my best to them, and we will be back together again. Okay. Iga, can you hear me? I need to
Słyszę
say,
pana.
yes, I can hear you constantly and without interruption. Thank you very much. Have a great day. You've really done a piece of great work. You've done a great job today. And so now take care of yourself and look after yourself and look after your frozen sponge.
I'm going to go for espresso and biscotti. That's good. Huh?
Wow.
Okay. Iga, I will send you an email. Okay. I will send you email later, Iga. Okay.
Jasna sprawa. Ja idę na
Sure thing. I'm going to have a Prosecco.
Okay. Dobrze. Okay. Bye-bye.
Thank you. Thanks to interpreters and to Przemek, without whom this would have been impossible, on the technical note. And let's see you Friday evening. So yeah, hopefully we'll cover more important topics. Thank you, Frank. Thanks, everyone. Thank you. Good night, and see you. Take care of yourselves. Take care. It's super important.